everybody, it's Michael Johnson here from Meta Johnson and Associates, reporting to you working from home during this COVID crisis with the working from home uniform of shaggy hair, a button-up shirt, and some sweatpants on. But I wanted to give some insight in terms of kind of what's going on frontline. I was talking to an attorney that refers to us today, and she asked the question, which I think a lot of people have, is um, how's it going in terms of nursing home admissions right now? What does it look like in hospitals? And what about nursing homes taking on new residents, especially those wanting to move from the community? So these were already difficult tasks to begin with. So certainly COVID has made it harder, and it really changes day to day. Fortunately, as time has gone on, testing has become a lot more accessible. That was one of the earlier issues. And what we've seen are communities initially kind of having a sense of uh, I guess, a badge of honor saying that they didn't have any COVID positive staff or residents. That's kind of what we break it down into. To now, where really it's obviously so contagious. It's pretty much everywhere, and it's kind of a foregone conclusion. So as of today, according to the Department of Community Health in the state of Georgia, there are um, 357 facilities that either have positive staff or residents or both. And it might just be one staff member. So just keep that in mind. Um, so, and if a facility isn't testing, which hopefully all of them are, they don't show up on this list. So again, the numbers are just a ballpark, really. The accuracy continues to remain in question, but it still gives us a good idea. And in terms of the questions of nursing homes, as I said, getting into nursing homes to begin with, rehab. If you have your 3-day hospital stay, getting there in rehab makes it easier. Fortunately, during this time, Medicare has they've relaxed that standard. You don't have to have a 3-day hospital stay in order to qualify for rehab in a nursing home. I haven't seen that firsthand just yet. I'd be curious how that actually pans out. So there's that. Getting into nursing homes for long-term care, meaning you're not rehabbing something like maybe you broke a hip and you're trying to get your strength back. That's always been challenging again to begin with. So this is just making it harder. Private pay, of course, makes it easier. Medicaid makes it more difficult to get in. And again, testing is one of the big things right now. Nursing homes, some of them are requiring 2 negative tests, and really, within the past 24 to 48 hours, if someone's in the hospital, that can be hard to do. If they're in the community, that's a lot harder to do. But we are helping our clients with that. We have some resources for that. Um, so yeah, really testing is the big thing. In some communities as well, nursing homes, assisted livings too, when they do find out that they might have a positive staff or resident, then they tend to go down into lockdown mode, not accepting any new people until they've done a full round of testing with everybody, and quarantining people that need to be quarantined, which is also to say a number of facilities. So, for example, we had a client that was in a rehab facility and had to go out for a specialist appointment and return to that rehab facility. And upon her return, she was put in quarantine in her room for 14 days, which is protocol. And did continue to receive rehab in her room, but that's still different than being able to go into the gym. So, understandably, those precautions are necessary. and it is still impacting the care of the patients. That's kind of some insights from the front line. Hopefully you found it helpful. And if you have any questions, feel free to give me an email or a call. Take care.